is unable to report. Kelly's trying to get me on the other laptop here. Everybody's waiting just to start.
Mm-hmm.
You have to host it for me. I can, Kenny's working on the other laptop here.
So sounds good. Because I'm live right now.
Hi, I'm State Senator Paul Wojno, and I want to thank everybody for joining us with our Medicare town hall this evening. I do have a little bit of a technical problem at my end. I know that everybody can hear me, but I cannot hear you. But I do want to thank everyone for participating in this. We have a presenter. His name is Jim Fournier, and he'll be giving a PowerPoint presentation. Jim has over 20 plus years of experience dealing with Medicare issues. If you have any questions this evening, you can type those in the chat, and we'll be able to answer those at the end of the presentation, which should go approximately 45 minutes. Also, we will reach out to everyone after the presentation and make sure that all your questions are answered by Mr. Fournier in the next day or two. So with that, I want to introduce Jim Fournier, our Medicare expert, and he'll be giving his PowerPoint presentation for everyone this evening. Thank you.
Thank you, Paul, and thank you everyone for attending today. As Paul said, we are going to be talking about Medicare, and we're going to be talking about the important things that everybody needs to know, regardless of when you do come on to Medicare. So there we go. You should see my slide now. And it's you know, they're
Get it set up and let me know.
So what we'd like to do is, first of all, just do a little bit of disclaiming here that the object of this session is to be a brief presentation, and it's an education session, talking about what the basics of Medicare coverage are for the residents in the state of Michigan. All Medicare eligible and soon to be eligible Medicare participants should be aware of these basics to avoid coverage complications, along with possible late fees and penalties. And this next part, I cannot stress enough, this is not a sales presentation for any specific private insurance company that offers different parts of Medicare that we'll discuss. Rather, we will provide some of the requirements private insurers must follow in order to offer Medicare plans. So just throw that out there, because Medicare is quite specific on what it deems to be an education session versus a sales session. So we'll get that out of the way. And here are our objectives for this next 45 minutes. And that is, who does Medicare cover? When do you apply for Medicare? What does Medicare cover? What does Medicare cost? What does Medicare not cover? Where do you go to apply for Medicare? And what is a Medigap, or in other words, a Medicare supplement plan? What is a Medicare Advantage or an MA plan? Where do you go to get Medicare prescription drug plan, which is also referred to as a PDP? How does a Medicare PDP plan work? When can I make changes to Medicare? And where do I begin? So we're going to begin right here, just in letting everyone know that Medicare is the federal insurance program administered by CMS, which for the federal government are the Centers for Medicare and Medicaid Services, and they primarily are directed toward three groups. Now, keep in mind, and I know that over the years, when I've gotten people to, they're getting ready to retire, or getting to the point to Medicare, that they tend to use Medicare and Medicaid, interchangeably, and that's not really correct. So both are federal programs, but Medicaid services are actually applied for and done through the state, where everything else with Medicare is done through the federal government. So who's covered by Medicare? Well, we've got three main groups. The first group is probably the largest group, and that is all U.S. residents age 65 and older. So that is the prime group of people that are covered or will be covered by Medicare. You'll have some people under age 65 with specific disabilities that will be covered under Medicare. Those would include disabilities where Social Security deems them to be totally disabled, and after receiving 24 months of Social Security benefits, then that participant becomes eligible for Medicare, even though they're not 65. And then people with end-stage renal disease or kidney failure, that's the third part that Medicare participants are made up of. So these are the three categories that make up the persons that would be covered by Medicare. Excuse me. So with the main category being age 65, the question will be, well, when do I enroll? Well, when you're turning age 65, you have, and it doesn't matter whether you're going to continue to work or you're going to retire. That period is called your initial enrollment period. It is a 7-month window that includes the month of your 65th birthday. And you have the three months before, the month of, and the 3 months after. So there's a 7-month span in which you must notify Social Security, who handles a lot of the Medicare enrollment, that you're 65 and that you're now eligible for Medicare. So, for example, I will be 65 in September. So my June last month was my first month out of the 7 that I could apply. This is the second month. August will be the last month. And then my birthday month is September. And then I've got the 3 months after. So it gives you that window only because you need to let Social Security know what is your intent at age 65 so that they can set up your Medicare properly. You can go online to do this, and you can see the website at the bottom, which is SSA, Social Security Administration.gov/benefits Medicare. Now, when you go to do this, it does not matter that you may or may not start your Social Security benefits. We're just talking about Medicare health benefits. So you can still enroll in Medicare or do the mandated enrollment to let them know that you're either going to retire or continue working. But you do not have to start taking your Social Security benefits at that time unless you want to. You can also do it by calling Social Security at 1-800-772-1213. And I've been informed just in the last month or so that I guess most of the local Social Security offices are not taking walk-ins. So I don't know if that's just going to be temporary, but or if they're going to eventually do it with appointments. So, doing it online is very quick. And you'll actually set up a sign in with SSA.gov, and then you'll be able to set up also your sign in with Medicare.gov as well. So that is the initial enrollment period time. And this is a very important time, like I said, even though you may still be working. But certainly if you're going to be retiring and not working past age 65, you must sign up for your Medicare during this initial 7 months without fear of being penalized. Now, if you're turning 65 and you plan to keep working, that's okay. You still want to go in and apply to Social Security, indicating that when you turn 65, you want to delay your enrollment in both Part A and Part B because you are still working and you are covered under a plan that has more than 20 employees. All right. So this could be like myself, but I'm covered under my spouse's plan and she works for a company that's more than 20 employees. So it doesn't have to necessarily be where you work, but if your coverage your medical coverage is with a company that has more than 20 employees, then you may delay your enrollment into parts A and B, and you'll indicate that when you sign in to check or to enroll. Check with your benefits manager or the benefits manager of whatever company your group healthcare is coming from, because in most cases, what will happen, that plan will remain primary. So the coverage that you had before is going to stay that way, and Medicare really does not have any part in paying your health coverage while you're still on that group plan. All right. If your employer or the employer you have your benefits through is less than 20 employees, meaning 1 to 19, then you must sign up for parts A and B of Medicare during that 7-month window. And your Medicare A and B will now be your primary coverage, with the plan from your employer being the secondary coverage. So these are not situations that are set up by employers or by the carriers, but these are written within Medicare and part of what is referred to as the Medicare secondary payer law. And again, there's your enrollment information at the bottom. This is probably the most confusing part. And over the years, we have seen where, people didn't go to register, or they did, like in number 2, they did, but they only registered for Part A and didn't take their Part B, which is very important. And when they finally did enroll in Part B, they get tagged with a late enrollment penalty, for all the while that they're on Medicare. So it kind of follows you. It's not just a one-time penalty. So that's why it's important when you're in your initial enrollment period to make sure that you do apply or let them know that you're deferring your Medicare because you're covered under a large group plan. You may still receive a Medicare card if you're still working, that will show your name, your Medicare number, and showing that you have Part A. And that's okay, because it's still not going to cover any. I mean, it's not going to do anything to supplement the coverage you have, and it doesn't cost anything, because Part A is the part that has been coming out of our paycheck on every payday. That you've got FICA taxes, and then you'll have Medicare taxes. So that's the part we've been paying into that covers your Part A when it's time to apply for your Medicare. Here is the Medicare secondary payer law as it's written, and I pulled this right from Medicare.gov. But down here at the bottom, this is the part that indicates that if the individual is 65 or older and covered by a group health plan, it's GHP, through current employment or the spouse's current employment, and the employer has 20 or more employees, then Medicare pays second. And it really doesn't pay anything at all, but it does not really do anything until you're no longer covered under that plan. So when you enroll in the responsibilities of employers under the MSP or Medicare secondary payer, as an employer, they must, or if you are the employer, ensure that your plans identify those individuals who the MSP requirement applies. I know that a lot of employers depending on their size and if they really have a human resources department, may or may not know this, but hopefully if they do have, they've been using a licensed agent to get their coverage for their group, usually that is a resource they can turn to. The employer needs to ensure that the plans provide the proper primary payments when whereby the law Medicare is secondary, meaning their plan remains primary. And also ensure that plans do not discriminate against employees or employee spouses age 65 or older, people who suffer from permanent kidney disease, and disabled Medicare beneficiaries from whom Medicare is a secondary payer. This doesn't happen a whole lot, but we will see in occasion where an employer might have even though you're still working, that they're only going to cover you to age 65. Or, if you are disabled, you won't be covered anymore. And those are things that they cannot do. Medicare will be involved there, and their plan will still have some involvement, but an employer has to be very careful on limiting who their plan can cover and not cover outside of being a full-time employee. So what are the parts of Medicare? You heard me talk about Part A and Part B. Well, Part A is the main part. And like I said, it's the part we've been paying for out of our paycheck. And it covers hospital care. So really that big ticket item of hospital care, skilled nursing care, which would be going into a facility for rehab, say after a knee replacement or something. Part A has coverage for up to 100 days per year, for skilled nursing care. It pays for hospice and if you qualify for home health care. All right. Part B is the part that will cover your doctor's visits, mental health care, your outpatient surgery. So you're not admitted to a hospital, but you're having surgery, lab tests, durable medical equipment, which would be like oxygen, wheelchairs if you qualify, etc. And Part B also covers if you need blood during a procedure. Medicare pays for a blood when needed for a blood transfusion, but begins paying with the fourth pint. And the attachment that you can make to your Medicare will pay for the first three, but it's just one of those quirky things. I'm not sure how the forefathers wrote that in there like that, but it starts picking up and paying for blood when needed during a procedure when you need a fourth pint or more. And then Part D, which we haven't talked about yet, Part D is prescription drugs. And those are purchased through a private insurer like Blue Cross Blue Shield of Michigan, Priority Health, HAP, any private insurer that contracts with Medicare and abides by Medicare's standards for how they can write a prescription plan. As you can see at the top, Part A and Part B together cover approximately 80% of the total Medicare costs. All right. And that leaves the remaining costs to the patient. Private insurers offer multiple options to help covering different, that's for Part D, for covering different meds, some with minimum requirements by Medicare with additional meds covered. So prescription drug plans through for a Medicare drug plan are going to differ a lot from what a drug plan would be from a carrier. And we'll talk a little bit more about that when we get to Part D. So as I mentioned, what does Medicare cost? There is no premium for Part A. You can see down below that it says it has no premium as long as you've worked full-time for 40 quarters, which is 10 years. If you have worked less than that, then there'll be a prorated amount for premium. Or let's say you didn't work because you have a spouse that worked and provided, you would still be covered under that because you would be under the wing of your spouse's Medicare coverage. And even after your spouse may pass away. Part B comes with a premium. For 2021, the Part B premium is $148.50. That's one of the reasons why, if you're still working and you want to delay your Part B, I mean, there's no sense starting to pay for it if it's not going to pay anything for you. So Part B does have that amount. It changes every year. Last year, I think, was like $144.60, so it did not change a lot. And as I said on the previous page, it's the one that covers your doctor's visits, mental health care, outpatient surgery. And here's another important piece too. It covers the surgeon's fees. So while, you're in hospital and you've got hospital care and it'll cover your nurses and things like that, Part B is actually the one that pays for the surgeon's fees. So someone like an anesthesiologist or the surgeon that actually is performing the procedure. So, Part B and Part A work in concert with each other, and they both cover different things. So it's important to have them both. As I said on the previous slide, those two together cover approximately 80% of all the cost. And I have had clients over the years that said, well, what do I need to have a supplement or Medigap policy for? Because, I can cover the 20%. Well, first of all, 20% could be, for someone that might have to have a quad bypass, you could be looking at 20% of $150,000, which would be like $30,000. And there's no maximum of how much of those 20% that you would pay in a year. So, like a lot of plans through employers, you'll pay out of pocket up to a certain amount. And then if you hit that amount, the plan pays for everything in full. Medicare does not do that. So that's why it's good to have another plan to choose from that helps you pay that extra 20%, because even though it's a low amount, the cost of the care that we need is going up. And 20%, as I said, of a large amount is still going to be a large amount. Part D prescription drugs are not actually sold by Medicare, but they are sold by private insurers. And the drugs are paid for the private insurer. So, like for locally here in Michigan, we know who the large carriers are. And they all have standalone Part D programs. And then you also hear the ones on TV like AARP and so forth that also have them that are underwritten by a health insurance company. So Part D is an added part. That was added back when President Bush was first took office, and there was a big Medicare rewrite, and that's when Part D prescription drugs came on the scene. and became part of the Medicare mix of coverage. Part D premiums vary by insurer, and so does the formulary. The formulary is just a fancy word for the list of medications covered. So Medicare will mandate that prescription plans, if an insurance company is going to offer them, must cover a certain number of medications to cover certain categories of need. But it does not say, what specific ones they are. So this is a thing that takes a little time to actually make sure, especially if you're on a lot of medications, to make sure you get the right Part D plan and find out what the cost of the medications you're taking, and to make sure that they are covered. Because you could have 3 plans that cover one specific drug and another 6 plans that don't. So, that is something that, again, unless you go through that, you want to rely on some assistance from either the carrier or a licensed agent that knows how to handle Medicare enrollment and look for the kind of plans that work best for their client. When that change came through back in, it was the early 2000s, there was an added cost called the Income Related Monthly Adjustment Amount, or IRMA. And what that means is that I had mentioned that, the Part B premium for this year is $148.50. Well, that $148.50 will be your premium, and when you look at this chart, if you're a single tax filer and your adjusted income is $88,000 or less. If you're married and file a joint return, then your joint return has to be $176,000 or less. If you follow either one of those two, then you'll pay the $148.50. And you can see at the very top that for 2021, Medicare worked with the IRS, and they are using your tax figures or income from 2 years prior. So for 2021, to determine if you are going to owe an IRMA amount, they are using your 2019 taxes to make that determination. So next year, when we get to 2022, they will then use your 2020 taxes to see where you fall on this table. So then if you a single tax filer and you earn above 88,000, but no more than 111,000, you will pay 207.90. So it's not plus the 48, but the 148.50 goes to 207.90. And the idea of this IRMA charge was, as people retire, and especially people that have a much higher net worth, that they contribute more toward the Medicare cost for Part B. And you'll see here in just a second also Part D. So ultimately, what would happen if we go all the way down to the bottom, if you are a single tax filer and your adjusted amount is $500,000 or more, instead of the $148.50, you will pay $504.90 for your Part B. And if you're married and file a joint return, that threshold is $750,000 and above. I've had a couple clients that kind of got shocked into this because when they retired, they were given a one-time bonus, executives, due to their employment contract. And, it was paid out a couple years before. And then when they go and file for their Medicare, then they will get a letter from Social Security saying, because your income in 2 years prior in 2019 was X amount, your Part B premium is you're going to pay the 140. You're going to pay the 504.90 rather than the 148.50 per month. Now, the good thing is, as we get into the next year, and then they use as the tax returns, tends to adjust. And if that, your income level starts to level off and go below that, then you'll start to see a decrease in what that amount is. So it's not like you're going to be stuck at that. But again, the purpose of that back was to make sure that higher net worth people, when they retired, contributed more to the Medicare Part B premium. Part D, or the drugs, are the same. So that when you are looking for a drug plan, and you're a single tax filer or a filer earning less than $88,000, you will just pay the premium that of the plan that you chose to have your drugs covered with. If you're above 88,000, but up to 111,000, you will pay your premium plan plus an additional $12.30. So that $12.30 is actually the IRMA adjustment for your income. So as you go down this scale, you can see that at the highest rankings at the bottom, you would pay your plan premium plus $77.10 for the IRMA adjustment. And if we're talking you and a spouse, and you're both married, that's what each of you are going to pay. The same thing with the Part D. The reason this comes out as a certain amount plus your plan premium is because the plan premium you're going to pay directly to the insurer that you're purchasing your prescription drug plan from, and Medicare collects the IRMA amount, like the $12.30 to $31.80, and you will get a separate bill from a company that Medicare has hired to collect any IRMA adjustment amounts. So those are, I don't get too many that fall into, or at least I haven't gotten too many. I've had a couple that fall into the bottom three categories, but usually it's the first two, and many of the ones are that first level. What that tells me is, if you've got flexibility when you retire and your pay is leveling off, if you want to look to retire and what you're going to be making in 2021 and where it falls here, then you'd want to consider retiring in 2023, because it's going to use this year's tax amounts to determine if you have an IRMA adjustment to pay for. What Medicare doesn't cover? Well, under Part A, like I said, the majority of it, what Part A covers, is your hospital cost. And it covers everything except the first $1,484 when you go into the hospital. From day 1 up to day 60, it covers 100%. If you're in 61 to 90 days, it'll pay everything but $371 a day. And if you are in for 91 days or more, then it'll pay everything but $720. If you go to a skilled nursing facility for rehab, it covers in full day 1 through 20, and then days 21 through 100, which is the max for the year. There is a daily, it'll pay everything but the daily amount of $185.50. Okay. Part B, on the other side, after you pay the first $203 for Part B services, because that's the deductible or the amount you have to pay before Part B starts to pay, then you can see it pays 80% of doctor visits and everything that it covers there. So you can see that between the two, even with Part A covering a lot of things, there are amounts in here that you know, they have to be paid for by the patient, and there are plans available to help you pay these amount, so that you're not paying almost $1,500 when you go into the hospital. One thing to note at the bottom is that neither Part A or Part B of Medicare covers dental, vision, or hearing coverage, and seldom does it cover costs when you're involved in a car accident. So those of you that may be 65 already, you may be contacted by your auto insurance carrier to indicate if your medical coverage, if you're still working, will be the primary coverage in case of an auto accident. And then, of course, it'll adjust the premium accordingly. But if you're on Medicare pays nothing toward that. I say seldom because occasionally it might pay something, but if another plan comes along and another plan pays for it, it will go back and recover what it did pay. So just keep in mind that once we are 65, and it doesn't matter whether we're working or not, that Medicare does not cover anything when you're involved in an automobile accident. Now, are there plans to assist paying for those out-of-pocket costs? And the answer is yes. You've got one of two types of plans that you can look at. The first one, and the one that's been out since the 1960s, is called the Medicare Supplement, or also referred to as a Medigap plan. And the reason it's called Medigap is it pays for the gaps Medicare doesn't. So you can choose a plan that, like if you go into the hospital and Medicare Part A pays for everything but $1,484. If you choose the right Medigap plan, it will pay the $1,484 for you. These Medigap or supplement plans are designed by Medicare, but sold by private insurers. So Medigap plans are actually very specific. I don't want to say they're numbered, but they're lettered. And they go from Plan A to Plan N, as in Nancy. Plan A covers specific things in each category, as do all the plans through Plan N. Those are dictated by Medicare. So if a private carrier is going to offer Medicare supplement or Medigap plans, and let's say you choose a Plan A or a Plan N, that let's say you're looking at Blue Cross, you're looking at HAP, and you might be looking at United Health through ARP. The coverage is going to be exactly the same. It has to cover the exact same things in the exact same amounts. The difference is going to be how the premium is calculated and how much you have to pay for that coverage. So the coverage you're going to get would be identical from carrier to carrier for the same lettered plan, but the variable is how the premium is calculated, both at the beginning and moving forward. Typically, premiums for these plans are based on the age, your gender, county of residence, and if you smoke. Now, if you apply for this Medigap plan when you're at age 65 because you've retired, because you've applied for it during that initial 7 months, your Medigap plan will be considered guaranteed issue. So it's not going to matter what your gender is, because it will have to take you without adjusting premium. If you decide to change from one plan to the other after you've had it, say you want to increase coverage or decrease coverage, then the carrier is going to take into consideration all of your health issues, which it'll ask, and then it can charge you the base premium, a second level, or a third level premium based on what your health conditions and risks they would be to the carrier. The other plan option that you could use is also called Medicare Advantage, or an MA plan. These are typically the ones that you see being sold on TV. MA plans are a lot like plans that we would have now through our employer, meaning they could be a PPO, an HMO, or an HMO POS plan. Again, these are offered by private insurers, and at minimum, Medicare requires that the plans must cover at least what Part A and Part B cover. Now, a carrier can go ahead and add extra benefits and make it more appealing. And any plan that's put together, that carrier must send to Medicare to get formal approval. But you will see that looking at a Medicare Advantage plan, typically a carrier may offer more than one. So they'll have that base plan of the minimum that it is, and then they may offer a plan that has a little bit more. And I've seen carriers offer up to 4 different plans, just kind of depending upon your medical needs, where you are. Do you use healthcare a lot because of chronic conditions, or do you seldom use it? So those extra benefits can be built in and added to the plan. Some of those extra benefits that can be added, and they do add, would be having your teeth cleaned, not necessarily for root canals or fillings, but having them clean and x-rayed twice a year. Might include an eye exam, not necessarily reimbursement for glasses or lenses, but an actual exam itself. It will just depend on that carrier's plan and how they try to differentiate themselves from their competitors. The premiums on this plan are based on those same criteria. However, on a Medicare Advantage plan, it's primarily based on the county of residence. So, Wayne, Oakland, Macomb, and Monroe County, those 4 counties, no matter what county you live in, the price is going to be the same for a plan, because they're all rated based on what benefit costs are and so forth. Most Medicare Advantage plans will include prescription drugs. You will have, generally per carrier, one plan that may not offer prescription drugs, but most of them do, and they'll be referred to as an MAPD, so Medicare Advantage with Prescription Drug Plan. And but we're going to talk here in just a minute of things to think of with a prescription drug plan, even though you might think you need one or don't need one. Here are the Medicare supplement plans that I spoke about. You can see in the blue columns, those are the current plans that are available: A, B, D, G, K, L, M, and N. Now, it does not mean every carrier will offer all 8 of those, but usually some will. Most will have like a plan A, plan G, and plan N, and may throw in one of the other ones. Beginning in January 1st of 2020, there used to be a plan C and a plan F. And those two were, to use a term that a lot of people use, were Cadillac plans. That virtually, if you had a plan C or a plan F with your Medicare A and B, it covered everything Medicare didn't. Medicare dissolved those plans so that if you turn 65 before 2020, you can still enroll in them. But if you turn 65 after 2020, those are not available to you, and you must choose the ones in blue rather than the ones in that aqua color. I can tell you that the clients that I've had that were on Plan C or Plan F, if you were on it, you're allowed to keep it as long as you paid the premium. And because they were both plans that virtually covered whatever part Medicare didn't cover, that's one of the reasons why Medicare dissolved those plans, is because they found there was more utilization since there was nothing for the patient to worry about having to pay. And, thought that at least if the patient had to pay like that $203 of Part B, that it would help the overutilization, meaning going when, you think you might have to go, but since it doesn't cost you anything, you're going to go anyway, even though you could probably take care of yourself at home. With a Medicare Advantage plan, like I said, they come in 3 different categories. A PPO, and that's just like a PPO we could have from an employer, where you have, if you go to a PPO doctor from that carrier, you've got the most amount of coverage with the least out of pocket. And if you go out of network, it will still cover you, but you will have to pay more out of pocket. With a PPO plan, no referrals are needed. You just want to make sure that if you go to a physician or facility, that you look to see if that facility or physician belongs to the PPO plan that you're enrolled in. It's the same thing for a Medicare Advantage plan. If you choose a Medicare Advantage plan, you want to make sure that the doctor takes that carrier's Medicare Advantage. And just a note of caution, that doctor could take the PPO, could be a PPO doctor of that carrier. And again, I'll just use Blue Cross as an example. So that doctor could be a Blue Cross Blue Shield PPO doctor, but it doesn't mean he or she is going to be a Medicare Advantage Blue Cross PPO doctor. So there's, just a little legwork. I mean, you'll always have things covered. It's just a matter of, if it's a participating doctor, you pay less. If it's out of network, you're going to pay more. An MAHMO is just like an HMO that would be on. You choose a primary care physician to handle, the majority of your care. If you need to go to a specialist, you need to get a referral from your primary care physician. And there is no out-of-network care at all, except for ER. And that's true for the PPO as well. That emergency room visits must be covered at in-network rates, especially if you travel outside your area or outside the state of Michigan. So, but on the other hand, a Medicare Advantage HMO PPS is kind of a hybrid where you still choose a primary care physician, but you can go to that HMO POS specialist on your own without getting a referral. So it's kind of a little bit of the HMO and a little bit of the PPO. And POS stands for point of service. So you still choose a primary care physician that you should see for all your regular care. If you think you need to see a specialist, like a dermatologist, just check to make sure that he or she participates in that Medicare HMO POS plan. And again, you cannot refer yourself to any non-participating doctor of your plan, except in the case of an emergency room visit. As I said before, most MA plans include prescription drugs and may have many extra benefits like dental, vision, and hearing, transportation of doctors, and some of these plans will actually have a zero premium, depending upon the carrier and the kind of plan that it is. And that will vary from carrier to carrier. So how do you get a prescription plan? If you choose a Medicare supplement or Medigap plan, you can choose your prescription plan from any other carrier that offers the Medicare prescription drug plan. So if you chose HAP for your Medigap plan, you could go to Blue Cross and get your prescription plan if it works out better. The prescription plan does not have to come from the same carrier that you got your Medigap plan from. With a Medicare Advantage plan, though, if you choose a plan that doesn't have prescription coverage and you decide you want it, you have to get that prescription coverage from the carrier you got your Medicare Advantage plan from. And like I said, then it would be called an MAPD. So again, with the Medigap, you can have the medical part of it from one carrier and the prescription part from another carrier, which is an advantage because remember, all the carriers do not cover the same drugs the same way. Or with the Medicare Advantage plan, you have to have the prescription drug plan from the same carrier that you get your Medicare Advantage from. And there again, you want to make sure that if you choose that one, that it has the meds on it that you take and that they are affordable. One of the things that you need to know, and it's important, it's at the bottom, if you do not enroll in a prescription drug plan when you are first eligible, so that means in that 7-month period, or let's say you work after 65 and retire at 69, you do not apply for that within 60 days of losing your company plan, then you'll be subject to a late enrollment penalty for the prescription plan. So I have clients that tell me, well, I only take a Bayer aspirin and my blood pressure medication. And he says, I go up to Meijer and, I pay $4 or maybe it's free. I really don't need that. That's fine. But keep in mind that, 2 or 3 or 4 years down the road, things change and you want to add prescription plan, that can be done. We'll look for a plan that covers what you're taking, but you're going to pay that plan plus a certain amount calculated for every month you didn't have it when you were first eligible for it. And again, that penalty will follow along with you forever and ever and ever that you're covered under a PDP plan. So where do you get your prescription plan? Well, as I've been saying, when shopping for a plan, keep these things in mind. Make sure you have a list of all your medications, the dosages and frequencies. So if you're taking a medication, make sure on the bottle, you see it's a 100 milligram tablet taken twice a day. Those are the kinds of things. Private insurers can offer several options with different premiums. And the formulary or the list of covered drugs will most likely be different with each option. So, there again, it just depends on the carrier and what you are taking. All PDP plans, as I mentioned before, have to have the minimum number of drugs per treatment condition. Your primary residence must be within the plan's coverage area. So if you're here in Michigan, particularly here in the Detroit area, and let's say you go down to Florida for 6 months out of the year, you're fine because your Michigan address is still your residence. But if you decide to move to Florida, then you will have 6 months to move to a prescription drug plan based out of a Florida carrier or a Medicare Advantage plan based out of a Florida carrier. So that's what it means, staying within the coverage area. And then each drug chain, so the store, CVS, Walgreens, Rite Aid, whatever, Meijer, can have different pricing for the same drug. And generally, when you look at these, when you look at the coverages, it will let you know based on the plan you're looking at if a particular pharmacy is a preferred pharmacy or a standard pharmacy. And the difference is going to be your preferred pharmacy will generally have the medication available for a smaller out-of-pocket amount, and a standard might be higher. I can tell you too that getting a 90-day supply, if the med you're taking, the government allows that, can be a very effective option. And again, this doesn't make logical sense, but I helped a client yesterday where she had 3 medications. If she got them every month, went in and got her prescriptions every 30 days, one was going to cost $8, one was $15, and one was $12 or something. But if she got a 90-day supply and had it mailed to her house, she got all 3 of those drugs for no cost at all. So that's also another thing to look at too, because the frequency that you get it can determine what kind of pricing you could have as well. So the minimum guidelines for Medicare prescription plans for 2021, if the plan is going to have a deductible, meaning the amount you have to pay before the plan pays, it can be no higher than $435. There are plans with $0 deductible. There's plans with $100 deductible, and they can design them with any amount between $0 and $435 this year. And like I said, that's the amount you pay before the plan pays anything. Then, when you're in your initial coverage period, which is when your out-of-pocket costs have reached $436 up to $4,130, the patient will pay no more than 25% of the covered drug until your out-of-pocket for all of these drugs reaches $4,130. And that word troop with the little R is not a typo. It's a Medicare acronym for true out-of-pocket costs. So you'll, and then again, it says up to 25%. So at preferred pharmacies, you could be paying a lot less than that. But these are the maximum guidelines set up. And we've all heard about the donut hole or the coverage gap. That is between $400 $41.31 and $6,550 that you're paying out of pocket. The patient pays 25% of all covered drugs until that maximum of $6,550 is reached. And then once you get to $6,551, you're now in the last category referred to as catastrophic coverage. And if that's the case, for drugs that are under $74, you will pay $3.70, or if it's a covered generic, or 5% of a covered generic with a retail price over $74. And if it's a covered name brand, you'll pay $9.20 if the cost of the drug is under $184, or you'll pay 5% if it's a covered drug that's over $184. So those are how the things are set up. I can tell you that here in the state of Michigan, there is a low income assistance program for prescription drug plans. And if you qualify and are approved for that, generally what will happen is you'll be able to choose plans where the amount of the coverage could be covered all or most by the program, and your out-of-pocket copays will be what those are in the catastrophic coverage area. So, but that's a state plan, and it obviously can help people that have assets under a certain amount, and it helps them save quite a bit of money. I know this looks like a lot of money here, the $6,551, but with the cost of some of these meds, especially name brand meds, that number can be reached at very quickly if you have a chronic illness or something like lupus or MS or something. So, but that's the minimums of how drug plans have to be set up for 2021. So with the donut hole, I had mentioned, what it would cost, for drugs up to a certain amount. If you have a brand name drug, the discount, enrollees receive a 75% discount off the brand name drug at the point of purchase, while you're in the donut hole. This discount includes a 70% discount paid by the brand name manufacturer and a 5% discount paid by the carrier of your plan. The 70% paid by the manufacturer combined with your 25% get added to your total out-of-pocket costs. So even though you're only going to pay 25% of that cost when you're in the donut hole for a brand name, you actually are going to get credit for the 70% that's paid for by that drug manufacturer. And the example is there. If you're in the donut hole and need a brand name medication that has a retail cost of $100, you're going to pay $25 for the medication, and you will receive $95 added to your out-of-pocket expense. So that was part of what Obamacare did to try to lower and get rid of that donut hole, and that's why I had it set aside as a separate slide. So I'm in a plan. When can I change it? Well, that's every year. There's an annual open enrollment period, or AEP. Every year it begins on October 15th and runs to December 7th. Those are the dates where you may now change plans, change drug plans, so that for them to go into effect on January 1st. I usually don't see a lot of people changing the medical plan part, say of a Medigap plan, because they know that they'll be medically underwritten. But if their meds change and now we have to look for another med plan that will better cover the new meds, those are the ones that I'll usually see, come in and or talk to and want to look at what other options would be. But come 11:59 p.m. on December 7th, if that application is not processed, you cannot process it and you cannot make a change until the following October. If you're on a Medicare Advantage plan, the Medicare Advantage open enrollment period runs January 1st to March 31st. You can make changes between a Medicare and a Medicare Advantage plan or change back to original Medicare during that time. If it's the first year that you've had Medicare Advantage plan and you change back to original Medicare, most carriers will not medically underwrite and would still consider it to be a guaranteed issue. But you cannot add or change a prescription drug plan to a Medicare supplement during that Medicare Advantage open enrollment. Changing a drug plan has to be done between October 15th and December 7th for a January 1st effective date. So where does all this start? First of all, online, you go to the Social Security, the ssa.gov/benefits/Medicare, or you can go to medicare.gov. You can call by telephone and take care of those needs that way. Like I said, when I went to ssa.gov/benefits/Medicare, you first have to sign in and create your own username and password. And once that was done, indicate when you turn age 65 if you're waiving Part B, and then it'll ask you to make sure. And then about 2-3 weeks later, you'll get your Medicare card that shows Part A only, because you're still on a plan from a large employer. And then if you need Part B, it will then show you Part A and B. The effective dates of these plans, if you are applying for within that 7-month initial enrollment period, your coverage starts the first of the month of your 65th birthday. So in my case, with September being my birthday, my Medicare would start September 1st. If someone has a birth date of September 24th, their Medicare coverage would start September 1st. If you're going to work after age 65, your Part A is going to say the first of the month that you turn 65, but your Part B will have the first of the month after the Medicare Part B app gets processed. And you'll actually have two separate ones, but it will always be the first of the month. And if you don't want to do that on your own, you can contact any competent licensed insurance agent with expertise in Medicare. And in most cases, if they offer Medicare Advantage plans and prescription drug plans, they must be licensed for those. So, and on top of their normal Michigan license, they must also be licensed and relicensed every year through Medicare to follow, changes that are made. And I'll just throw that up there without saying it. And if you need to contact me, you can do it through email or just go to my website, which is mededucationgroup.com. So just back to our disclaimer there. Let's see here. Emily, I guess we do have some questions, eh?
35 seconds for each question, okay?
Okay.
Nursing care,
how-
is long-term care covered under Medicare?
No, it is not. Long-term care is a separate policy on its own.
Are any mental health services provided under Part A or B?
Yes, there are conditions for mental health services, both inpatient and, say, outpatient with a psychiatrist, a psychologist, and those would be covered under Part B with the conditions that will be stated. In fact, when you apply for your Medicare, if you can see this, you're going to get one of these lovely books every year called Medicare and You, and it will give you all the qualifications of what needs to be done for a coverage for something like that.
What about telehealth? Are any telehealth services being provided now?
Most carriers are doing that. Your Medicare Advantage plans, particularly, where there might be a flat fee. I haven't heard it. A lot will depend on the with the supplement plans if they'll cover them. But I know that the Medicare Advantage plans, many of those have been added just this past year.
Now, one of our participants on Facebook is asked that they were told because they were on Medicare due to disability before 2020. Their question is, can they still get plans for F or G? Is that correct?
If they were, from what I've been able to read, and I will double check it, it was if you turned 65 before 2020. But I can check and get that information back, or if they want to email me, I'll find that out if they're allowed to have Plan C, if they're allowed to keep Plan C or Plan F. My guess is going to be that they're going to have it now, and they may be able to keep it, but
And we do have his contact, so we'll
okay.
make that we follow up with him.
Okay.
The second question is more of an answer on my office, but I was just wondering if you might have any background on this. ARP offers Medicare supplements to people who have Medicare due to disability in other states. Are you aware of Michigan ever approaching this in the past? But that's something that I can find out about as well.
Well, Medicare, when you're on disability under age 65, our carriers here, most of the carriers do offer the supplement coverage. The last time I looked, with the AAR plans through United Health in Michigan, they do not offer coverage to somebody under age 65 with Medicare.
Another question, from the time work insurance is ending,
Mm-hmm.
you activate Part B,
Mm-hmm.
then when will it be in effect?
It should be, and this is usually what I tell people. And we've got some friends right now where they're in their 70s. He wants to retire September 1st. So what I did is, once you pick your retirement date and you tell your company or your human resource to contact me, because Medicare has to be contacted, and there's a form that must go out to the employer indicating that you did have creditable coverage when you turned age 65. Once that's done, and if we can do it like 45 days before your retirement date, the goal is to try to get it to start, on that first of the month when you want to retire.
Now, I know you spoke about this earlier and I have a question. What is a Medicare premium?
Medicare premium is what you're paying for Part A, B, or Part D. So it's actually paying, Part A, you shouldn't have a premium because we've been paying for it out of our paycheck. Part B is the premium you're paying directly to Medicare to have Part B coverage. And Part D, as in David, is the premium you're paying to the carrier for having prescription coverage.
And these next two questions might go hand in hand, I'm not sure. What is Medicare co-insurance? And what is a Medicare out-of-pocket maximum?
Medicare out-of-pocket maximum, we'll do that one first. Medicare out-of-pocket maximum it's referred to as the most you would pay out of pocket for a given year. Medicare itself with A and B does not have a maximum out of pocket. So, if you're going to take just Medicare A and B in that 20%, you'll pay as many 20% as you have for that year. Your Medicare Advantage plans will all have a maximum out of pocket, which means that once you add up, let's say, all the percentage amounts you've paid, all the fixed dollar amounts you've paid, once it reaches the amount of that plan, and again, they vary, then everything under that plan in network is covered at 100%.
This is a good question, and these are ones that I received by email earlier today, so I'm going through the list. Can I use Medicare when I'm outside my state?
Outside your state, yes. Medicare only works in the U.S. So you got the 50 states, you've got Guam, Puerto Rico, but and I reference Canada all the time, since with us in the Detroit area, Canada is like going from Warren to Sterling Heights because of the bridge. And but basically, most of the all the MA plans and most of the supplement plans have a lifetime $50,000 emergency coverage when you're outside the country. And the idea of it is to get you stabilized and get back to the U.S., to the closest place where you could be put into a hospital and Medicare can pick the rest up. I'll tell people that cruise a lot, that's a good idea. And then on top of it, if it's a group thing that you're going on, to purchase the travel and health benefit, because to be airlifted from a cruise ship to whatever the closest port is, be it Florida or California, it's going to run in excess of $50,000.
Now, this I think I know the answer to, and I'm going to guess that it's probably the Social Security office or the website. But the question is, what happens if I lose my Medicare card?
Once you are signed up and you have your logons, you can call 1-800-Medicare or just sign on to your Medicare.gov, and it'll have a spot. What are you inquiring about? And it'll say reorder card. It'll ask a couple of security questions, and you'll have your card in a couple of weeks.
And I have two more questions. Who sells Medicare Part D plans for prescription drugs? Is it one company or are there multiple companies?
There are multiple companies. So some of them will sell only with an MA plan. So, for instance, here in Michigan, Priority Health sells Medicare Advantage plans, but you cannot go to Priority Health and get just a Medicare prescription plan. You can go to HAP, you can go to Blue Cross, and then there's a lot of ones that are outside the state that are very good. Express Scripts has one, Silver Scripts has one, which is owned by CVS. So you're not limited because we're in Michigan that we have to get it from a Michigan carrier.
And the last question, and you went over this, but if you can touch on it again, what is Medicare deductible?
The Medicare deductible, actually anything referred to as a deductible, is the amount that the patient must pay before the carrier begins to pay its portion on that procedure. Okay. So, and I remember a couple of questions ago, Paul, you mentioned about coinsurance. Here's a quick thing, because people say, well, what's the difference between a copay and coinsurance? A copay is a fixed dollar amount, $25 for an office visit, $200 for ER. A coinsurance is a percentage amount, 20% after this or whatever. Your deductible then is the amount that you pay, and after that, your plan will usually pay a certain percent, and then you'll have a coinsurance that you pay. But a deductible is the amount paid out of pocket before the carrier will even pay the first penny for whatever service is under that deductible. It's usually a deductible is annually. So it's not like you pay that deductible on every single service you have. Like in Part B, the $203. Once you pay the $203 for 2021, it's paid for. And now any of those services under Part B, Medicare will pay 80%, you pay your 20%.
And our last question, because we need to wrap it up here by 7:30, but my friend Buddy here wants to know if he's eligible at any time.
I know we can give them regular pet insurance. In fact, there is an MA plan I saw on TV somewhere that includes pet insurance, and they don't discriminate because of age. So,
As you can see, they're surrounding me because it's dinner time.
Of course,
nobody's here. But I do want to thank you for your time this evening. And if you could please share your contact one more time if anybody has any questions. But what we'll also be doing is everyone that has followed us tonight on Facebook, we will be reaching out to them and sharing your contact. And if they have any follow-up questions, we'll be happy to get back to them as soon as possible. So Jim, can you share your contact one more time?
Yep. If you go to my website, which is mededucationgroup.com, and then there'll be a place in there where it'll show where you can write in your question, and then on there will be my email address. And again, I even though I saw the email address on there, just because of that disclaimer I had at the bottom about a contractual arrangement, I couldn't put my direct email address, but I can send you to the website, mededucationgroup.com.
And yeah, we had a lot of individuals tune in this evening. I really appreciate that. I had several that I went to high school with, had a former teacher, a former employer. So it's been very interesting and beneficial. And Jim, I thank you for your service. And we will reach out to everyone that logged in this evening and caught part or all of your presentation. Thank you.
You're welcome. I just hope that it helps, because it is confusing. But, if it's not done wrong, and I've told you this before, when I first got into this business, the first Medicare mess that got set up prior to me, it took me 14 months to fix. So it became one of my goals to make sure that when I was in the agency side, that if I had a client that needed Medicare, that it was set up right, because I was not going to be able to take 14 months of fixing everybody's errors if it wasn't.
Well, Jim, we have a lot of thank yous here in the chat for your presentation tonight. And again, thank you very much. And I want to thank everyone else. I see someone would like to be contacted, and we'll make sure we get that information to them. I don't want to give their names because some of the questions might relate to their personal situation. So we won't do that, but we will make sure that everyone is contacted. Thank you.
Very good. Thank you, Paul, and thank you everyone for attending.
Okay, thank you. Good night, everyone.